And if you have any questions, please throw them into the chat. And at the end of both presentations, we're going to do some Q&A. Thank you.
That's great. Thanks, Christy, and thanks everybody for coming to listen. So we've had lots of questions and people sort of, wondering what the data is and what the science is behind having a third dose of vaccinations. And so we thought this would be a good opportunity just to kind of work through some of that. So I'm first of all going to talk about some of the sort of background science of the immunology of it, and then we're going to show some of the data about the effectiveness of the third dose, and then we're going to talk about who should get them and when, and then we're going to transition to Dr. Meeder afterwards to talk about children, which is equally important. So just a disclaimer that any of the information provided here is really meant for your sort of education information, but not specific medical advice to your own condition. And so if you have any anything that's out of the ordinary, then please seek medical advice from somebody that knows all of your history. So the first thing we're going to do is just review mRNA vaccines. This is all stuff that I've reviewed before, but just as a reminder that mRNA vaccines have actually been around for, the concept's been around for a long time. They were developed over 30 years ago. There's been several recent advances in technology that has led to the vaccinations being more successful, and this is obviously the first time that we've used them in sort of a widespread manner, but they've now been given to many tens of millions of people around the world, and are incredibly safe. And it's amazing actually to see how far we've come with it. But we've also used it for influenza, Zika virus, CMV, rabies, or some others that should be on the list as well. It's been looked at and tested for treatment of cancer, and just a reminder that this is not a live virus that people are getting, or it's not even a killed vaccine like many traditional vaccines. In fact, there's only a small portion of COVID that's in the vaccine, which is what makes it so safe, because essentially there's not enough information there for the virus to actually, for you to get sick or for it to sort of replicate and cause COVID. So the vaccines, as you know, are given in the upper arm muscle. It gives an instruction set, which is called the mRNA, into the cells, and it gives the instructions for the cells to make a harmless piece of spike protein, which is a protein on the surface of the virus. After that protein is made, the cell breaks it down, and it also breaks down the instruction set and gets rid of the instruction set. The actual piece of protein goes to the surface of the cell, and the immune system sees it there and then realizes that it's foreign and learns how to make antibodies against it, excuse me, which then protect you against getting COVID in the future. So this is a little bit new information, but I think it'll be relevant. So after our first exposure, or when we're immunized, then we produce antibodies that can sort of neutralize the virus. So if you look at the figure over here, you can see that virus sort of gets into a cell. It's then sort of plasma cells are made that produce antibodies, and then they neutralize the virus. And then between infections, the immune system remembers how to fight it via this thing called memory B cells, which can then turn back into plasma cells and produce antibodies whenever necessary. There's another component of the immune system, which is called the cell-mediated immunity, which are what are called CD8 cells and CD4 cells, and there's various other cells involved in it. But these cells can recognize whenever there's virus inside a cell, and they can tell that cell to die and then stop producing virus. And so then between infections, then the memory T cells can remember some of that information and keep you from getting sick. So high levels of antibodies can initially sort of kill the virus, and they prevent infection and lead to very short sort of periods of illness if you get sick at all. But after prolonged periods of time when we're not exposed to COVID or to other infections, then the immune system starts to slow down the amount of the amount of antibody that it produces, just because otherwise we'd be producing antibodies against every infection we'd ever seen in our lives, which could be thousands or more of different types of infections, and it would just overwhelm our body's ability to sort of function. But when we're re-exposed to virus, or when we're immunized again, then the body sort of remembers how to make those antibodies. Because it's got those memory cells that we talked about, it quickly increases the amount of antibody that's in the system, and again, sort of can prevent or minimize the amount of infection. And then just a reminder that if there's not enough antibodies in the body to neutralize the virus, the T cells, through the mechanism that I showed you, can still protect against serious illness by eliminating the cells that are producing the virus. And so even if the amount of antibody goes down over time, then your body can still fight it this other way. And the vaccines help to sort of produce this cell-mediated immunity. It's a slower response than that we get from antibodies, but it can still be highly effective. And it's probably a large part of the mechanism that keeps us from ending up in ICUs or ending up in hospital with infections after we've been immunized. And so, so the antibodies is only part of the story. There's another part to the story as well. So our experience to date with COVID-19 vaccines is that they've been highly protective against serious illness, hospitalization, death in most population, but the effectiveness does decrease with time. And then specifically with Omicron, not all of the antibodies produced will neutralize Omicron. And so we've started, as people know, offering boosters that can provide increased protection across the population by boosting those antibody levels and getting them higher again, so that we have that initial sort of extra protection from that extra set of antibodies that are in our blood. There's also more specific vaccinations against variants that are being developed but are not yet being available, and I'm not sure what the future of that will look like. We'll have to wait and see what the need is. So how effective have the vaccines been sort of for Omicron and with these boosters? So this first set of data is really about the data showing that boosters do work, and they work regardless of what the first vaccination series that you had. And so I'll just walk you through some of this data. So the top row is showing sort of the amount of antibody that your body has in it that binds to the COVID virus. The bottom is the amount of antibody your body has that will actually neutralize or prevent that virus from causing infection. And so the first sort of row of data here is for people that originally were immunized with Moderna. The second is for people that were originally immunized with Johnson & Johnson, or the Janssen virus, which is very, very similar to AstraZeneca. And then the third one is the people that were originally immunized with Pfizer. And so what you can see is that when people are boosted with either Johnson & Johnson, which we're not using in Canada, but more relevantly, the middle row, which is Moderna, or with Pfizer, then on day one, you can see sort of how much antibody they have. And then you can see here by day 15 and by day 29, how the antibody levels are going up. And so and they go up about the same amount, whether you're sort of boosted with Moderna or with Pfizer. And that's the same sort of regardless of what your initial sort of immunization was. And it's true of both those neutralizing antibodies, or the really effective antibodies, and then just antibodies in general. And so what this really shows us is that it doesn't matter what antibody or what vaccine series you had at the beginning, or which booster shot you're getting, the amount of response you get is really about the same. And the other question that people are asking is whether or not the side effects are similar regardless of the booster shot that we get. And so the top one is people that were boosted with Moderna that originally had, either the Johnson & Johnson or Moderna or Pfizer vaccines. And as you can see, the side effects sort of are almost exactly the same. And then people that are boosted with Pfizer, it's almost exactly the same as the top. So it doesn't seem to really matter whether you get Moderna or you get Pfizer, or which series you were originally vaccinated with. The side effects seem to be the same regardless. And so public health, based on this data and other data, which I didn't show you, has made it clear that it's very safe to mix and match Pfizer and Moderna COVID vaccines for booster shots. They both work the same way. They're actually more similar than they are different. Both of these vaccines were highly effective in all the original studies that sort of brought them to market. And there's also some research, some of it is what I showed you, but there's other research as well from the CDC that shows that mix and match strategy actually works as well as, or sometimes even better than, sticking with just one sort of vaccine throughout all of the immunizations. And so really, it doesn't matter which one you get, they all work just fine. So the second question is, do the boosters actually work against Omicron? And so, so this data is from a UK study that was just published about a week and a half ago. So the top row is sort of the vaccine effectiveness against Delta. The bottom row is the vaccine effectiveness against Omicron. And these are people that have had 2 doses of vaccine. And so as you can see, sort of as time goes on, so from 2 weeks to 25 weeks, the amount of protection that you get goes down quite a bit for Omicron, and it gets actually, this is the 0 line, it gets actually quite low after an extended period of time to protect you against Omicron. If we then boost people with either Pfizer or Moderna, then all of a sudden the protection goes way up to where it was before. And it does start to come down over time. This goes to 10 weeks here. And it's the same with Moderna as it is with Pfizer, but it does give you a huge boost. And this is why we're actually recommending that people get one of these 2 boosters. This particular data is data for people that were originally vaccinated with Pfizer. This is the same data for people that were originally vaccinated with Moderna, and you can see there's the same type of boost. And this is for people that were originally vaccinated with AstraZeneca, and you can see it works exactly the same. So again, this is real world data showing that the boosters actually are effective regardless of which booster you get and regardless of which vaccine you got at the beginning. This is some more data showing that the amount of symptomatic disease that you get goes down, the amount of hospitalizations you get goes down, and then we already talked about the viral effectiveness. So this is just some sort of data that I put here for people to look at later if they want. So then, if you decide then that you want to get the booster shot, what is the recommended dose? Well, your healthcare workers that are providing the doses will figure this out for you, but just some comments on it. So any individual that's moderately or severely immunocompromised, for reasons that I haven't gone into here, the recommendation from NACI, from the sort of National Advisory Committee, is that we give a 3rd dose of the same vaccine as the initial series, just because they have more trouble sort of getting the antibody levels to a proper height in the first place. And the more consistent we are in that sort of very, very limited group, the better. And so there's very specific recommendations around that group, which I won't go into here. But if you fall into that group, because of medications or because of illness or chemotherapy or those types of things, then it's worth talking to your healthcare provider. And chances are you've already been offered a booster shot and that's already been looked after. Older adults that are greater than 70 or living in long-term care homes or other sort of congregate settings should either receive Pfizer, which works perfectly fine, or the full dose of Moderna as a booster. But everybody else, except for a younger group, which I'll get to in a second, but everybody else can receive a half dose of Moderna if Moderna is being offered, based on scientific data showing that the half dose is quite effective in that group and does boost those antibody levels. And that's data that I just showed you, sort of showing how effective it is. Or they can receive Pfizer, and the Pfizer dose is the same regardless of whether it's a booster dose or a regular dose. If it's people between 18 and 29, then there is a recommendation that Pfizer is preferred due to that slightly lower incidence or causing pericarditis. And so there's some ways of sort of getting Pfizer for those groups. And it's one of the reasons why we're limiting how much Pfizer we're giving to people sort of older than that, because we're trying to use the Pfizer for that younger group. So who should be vaccinated with a 3rd dose? Well, so according to the National Advisory Committee, there should be sort of emphasis on frontline healthcare workers, as well as those at highest risk of severe illness, which would include older adults and those with high-risk medical conditions. But in Ontario, anyone who's greater than 18 is eligible to receive boosters if it's been more than 3 months since your last vaccination, and since a complete set of vaccinations. And we seem to have enough vaccine to be able to give all those boosters. And so really it can be everybody, but emphasis on the frontline health workers. So who is a frontline health worker? Well, it's all of us here. I put the definition here, but basically anybody that is having patient contact on a regular basis. And why are we recommending that? Well, healthcare workers are at increased risk of infection just because we're dealing with the general public and patients. They pose an increased risk of transmission to vulnerable populations because we're caring for those patients. we're all essential for maintaining the healthcare system capacity. Many of us were vaccinated much earlier, and so there's been more time for our protection to wane, and so even more reason why we should get that booster shot. And also optimizing the protection of healthcare workers can sort of balance that extra risk that we're all taking to to help patients, and sort of it's a bit of a sense of reciprocity that that we're helping out vulnerable people, and in return we get an extra level of protection. So what if you've had COVID-19 before? So the current recommendation in Canada is to get the booster according to the normal schedule, because we're not having issues with having enough vaccine. The recommendation is that you should wait until your symptoms are fully resolved, and that minimizes the risk of any transmission to COVID-19 at an immunization venue, and also enables us to monitor if there's any adverse effects from the vaccine, and then we can sort out what's from infection, what's from the vaccine. But it's not because the vaccine doesn't work if you get it sooner. It's really just so that we can monitor more appropriately and not infect people at the clinics. So just some final thoughts. If you're offered Moderna, should you wait, or should you get Pfizer? As I said before, they both work exactly the same. And if they're so similar, why is everybody preferring Pfizer? And really, it's just because we got used to Pfizer. It's what many of us had as our first sort of shot. And people are worried about sort of switching at this point. But in fact, they're so similar that it really doesn't matter which one you get. And we've gone through all that data. So the benefits of COVID-19 vaccines far, far, far outweigh the risk. And I think we should all, be fully vaccinated and boosted. And I think the data is very strong in that regard. So with that, I'm going to stop sharing my screen, and then I'm going to transition over to Dr. Meeder to talk about children.
Thanks, Kevin. Let's make sure I got the right screen up here. Good. I think you should be able to see that there now. Kevin, maybe you can nod, and can you see my my main screen now, or are you seeing both my notes?
We're seeing the presenter mode right now, so you might want to switch over to just the slide. Yep, that's it. Perfect.
Great. Thanks. For some reason, it always defaults to that presenter mode, and then you have to swap it around. So, well, thanks, Kevin, for sharing that information with us. And I do want to talk about kids, of course. But I think we both come at it from the same angle. Vaccinations are a huge benefit and a measure that we can all take to protect not just ourselves but others around us, and especially in this current wave that's going on around us. So I did present some of this information before, like Kevin did as well, but I wanted to tailor it a bit more specifically to the current situation with Omicron, which is now 99% of the samples out there are Omicron. And so this is really the variant that we're dealing with. And I want to focus specifically on kids and of course adolescents as well. That kind of fits in that pediatric age category, but focusing today on the younger kids, especially now that they're back to school, and you're like, okay, are they going to get exposed? And it's out there, it's in the community, and more than likely, we're gonna your kids are going to run into Omicron at some point. So just to recap as well, COVID-19 in children, I mean, generally it is mild or asymptomatic. We are hearing of more kids getting sick even after vaccination. Recently, it's felt to be a milder illness, but that's on a population level. I think because of the sheer number of kids getting infected now, we're just hearing more reports of someone who just kind of got quite sick. And so I think that's just because of the volume that's out there, that these reports are seemingly more common. Had we had these infections spread out over a longer period of time, they would have maybe appeared more anecdotal as opposed to a trend. Severe outcomes still are very rare in kids. There's a small risk of multi-system inflammatory syndrome, MISC. There's also an A version for adults, but it's definitely been recognized in kids. And with the Delta wave, that was about 0.5 to 3% of diagnosed pediatric cases. We're still waiting to see what the Omicron wave brings out in kids. Children aged 5 to 11 make up 7.5% of all confirmed infections. Likely right now, that was an underestimate before because many kids were mildly symptomatic or sometimes even asymptomatic. So it probably was a bit higher than that. Right now, we've kind of lost track of how many kids are getting infected. If kids are being diagnosed, it's usually with rapid tests because it's not possible to get PCR testing now. So we are not really able to say with certainty how many kids are getting infected. But I know just in talking to people, as I'm sure you have as well, that there are definitely kids out there that are getting Omicron. And definitely those that are ending up in emerge or in hospital are being tested. And we know that there are, in this wave especially, a number of kids in hospital with COVID and even in the ICU. So yes, it's a mild infection in the vast majority, but there are still some kids that can get quite sick with Omicron. And I won't belabor those, the numbers there, albeit to say that, severe outcomes are rare. And this is where things stand at the moment with regards to vaccination in general. We know that vaccination reduces the risk of infection. I'll get into more detail in that in a second. It does reduce the severity of illness, including multi-system inflammatory syndrome in children. In fact, studies show that in vaccinated kids, that is almost unheard of. So that is one protective factor of the vaccines. And of course, not just severity of illness, but it also reduces those markers of severity, which is hospitalization, ICU, and definitely those are reduced by vaccination. So right now, if you look at those bottom two lines, that's kind of where pediatric vaccination stands right now. So when we were in Delta, many of our high school kids were vaccinated, but none of the elementary school age kids were vaccinated. So you saw a bunch of outbreaks happening almost exclusively in elementary schools and only rarely in high schools. And that's exactly the reason why, because our vaccines were very protective against Delta. Now we have about 50% of our elementary school age kids vaccinated. So just over 50%. This is as of yesterday, January 19th, off the dashboard. So it's about as recent as we're going to get. The number of kids getting vaccinated is sort of, tapering off now on a daily basis. So we'd love to see that pick up more, and hopefully with some further information and reassurance, we hopefully are seeing more kids taking that step to getting vaccinated, especially now that schools are open again. You can see here the benefit of vaccination in general. If you've had at least 2 doses, you're gonna the likelihood of ending up in hospital is, reduced by about 80%, and likelihood of ending up in ICU is reduced by over 90%, and that's with 2 doses. I think even with a booster, those differences are going to be even starker. I don't need to tell anybody that COVID-19 has been a huge blow to kids in terms of their social and emotional and academic development. Ontario has had a lot of school closures, in fact, more than most other jurisdictions, and this is definitely one point of contention that parents have. We've had over 27 weeks since March 2020. Now that, is that political or whatever, we are a populated province. Not every jurisdiction is the same, and so there's probably other factors that figure into that, but needless to say, kids have had to miss a lot of school, and school is where stuff happens, development happens, friendships happen, socialization happens. Kids just connect, and they need to connect. Kids are social, and they need to be in social settings, and being stuck at home and isolated is not good for their development. We've seen a 6-fold increase in extreme absenteeism. That means missing over 50% of classes. Kids just eventually just checked out of school, and we're going to see the ramifications of that definitely years down the road. Social isolation, mental health effects. depression and anxiety reported by children and youth has tripled over the pandemic. It's now up to 1 in 5 for anxiety and 1 in 4 for depression. Other related disorders like eating disorders have just surged over the course of the pandemic. Reduced extracurricular activities, sports, all those things, increased stress in families and overall anxiety in our population. And this has been disproportionately meted out to marginalized communities, and communities that were already struggling are now struggling even more. We've seen kids lose approximately 7 months of their education on average. So that means many kids just kind of are, kind of got through. But kids who are already struggling we're struggling even more, and this gap has now increased. And we're going to see a lot of kids fall through the cracks because of the COVID, the last 2 years that we've had. It's going to take some time to undo that as well. What takes 2 years to develop is going to take years to undo. And so this is a huge stressor for a significant portion of kids' lives. Just to recap, I won't go into this in too much detail because I showed this slide before. This is how the vaccine got approved in kids based on initial studies showing effectiveness, with the Pfizer vaccine. You can see the number of infections after the vaccine was given compared to placebo. The kids with the placebo just, picked up infections over time, whereas those with the Pfizer vaccine, got 3 infections for the duration of this study. And this was enough to know that this is a very efficacious vaccine against the Delta variant. Now, Omicron is a bit of a different story. We know that protection against infection is not as good, especially over time. Probably initially, it's still quite good, but the exact data for that is still pending. Just in terms of side effects, very few side effects, a bit more common after the second dose. The actual vaccine is only a third of the active component is about a third of the adult dose, and so 10 micrograms instead of 30 micrograms. And I'll tell you in a second now with the NACI recommendations. Sorry, let's see here. I'll just jump here for a second. But with what NACI recommended, based on our experience with the other vaccines given over the summer to adults, was that spacing it out probably offers better immunity and in fact reduces the risk of adverse conditions, events like pericarditis and myocarditis. And so they very wisely said, let's space this out for 8 weeks for kids. However, that was when Delta was dominant and community transmission was at a low level, a much lower level than it is now. And so now a lot of parents are asking, well, could we do it in a shorter time interval? Because I'd rather have my kid get the 2 doses, the full course, and have better protection in the short term. And then we'll see what happens in the longer term versus waiting 8 weeks between that first and second dose. So public health will actually give you that dose up to 4 weeks apart. So if you wanted to give it sooner, they just have you sign a consent form saying that you understand that the recommendations are for 8 weeks, but you're opting to do it sooner than 8 weeks, and then they'll give you the second dose based on that. So it can be offered to kids who've had previous infections, so and especially those who have recovered from more severe conditions as well. Those kids can get the vaccine. So we've had a lot of kids now who've like, oh, I got Omicron, do I still get the vaccine? Yeah, once you've recovered, and I would say wait at least sort of 2 to 4 weeks after symptoms have resolved, and then you can receive the vaccine still. Right now they're saying avoid giving at the same time as other vaccines. That is not because of scientifically you can't mix vaccines or give them on the same day. Your immune system can handle it. It's just that when you're rolling out a vaccine, you want to monitor for adverse conditions in the much larger populations than what was studied. And so to confound any sort of adverse event reporting, they're saying wait 14 days before and after other vaccines. Over time, we'll probably see that, as we now know, the adverse experiences with the vaccines are not a concern with the COVID vaccine. that will probably see that recommendation start to fall by the wayside, and we'll probably give this vaccine with other vaccines down the road. Another question I get, what about if I turn 12 after my first dose? So you get the 10 microgram dose, then you turn 12, and then you're indicated to receive a higher dose. You know, do you take the 30 mic or do you take the 10 microgram? Again, they'll leave it up to you. And in general, they'll have the 10 microgram drawn up, but if you're like, I'll take the 30. So I kind of tell parents, you know, it's actually, it's neither here nor there. Nothing magic happens on your 12th birthday, you know, on that day. Your body is still the same, you know, the day before as it is the day after, virtually. So probably the 10 microgram is fine. If you have, like, I don't know, a smaller kid, you know, 10 micrograms might be better kind of for their body size. If you've got a kid who's, you know, kind of going through puberty and you think they're kind of more on the more developed side, then maybe a 30 microgram dose for their second dose would be better. So I leave it up to the families. So I'll just jump back here. You know, what about Omicron? Protection against infection. You know, we do know that this current variant is able to get through that immunity barrier easier, and infections are more common. Breakthrough infections are more common after vaccination. Now, initially, of course, there's still pretty good protection, but over time, it does dwindle down to, like, longer term, you know, 20 to 30%. Where, as Kevin's slide showed earlier as well. And right now, you know, we don't have boosters yet for kids or even for adolescents. So it's like, what do we do with that? And so it's still important, you know, in the short term, it does prevent against infection, especially in this current wave when there's a lot of community transmission. The vaccine can be effective. And then, you know, because the disease is milder in those who have been vaccinated, we presume viral load is lower, and so transmission is probably less than it is in kids who have not been vaccinated. And then, of course, the severity of the illness is less. I tell you, my personal experience is my whole family was fully vaccinated last fall when they were eligible, and last summer when my kids were vaccinated. We, Rose and I, of course, earlier on in the pandemic, fully vaccinated, and then unfortunately one of my kids was in contact with someone who was positive, and we had breakthrough infections. So we did all the isolation, and we taken all the precautions, but, you know, the biggest thing as a parent when I saw my kids testing positive was I had the peace of mind to know that they were fully vaccinated, and that would reduce the possibility of more severe outcomes significantly. And as a parent, I found that extremely reassuring. They did get some symptoms. You know, it was a bad cold at worst in my family. Myself, you know, I barely got any symptoms, and I credit that a lot to my vaccination status and the booster that I received in November. So that, I think, as a parent, there's a lot to be said for that peace of mind, knowing that you've done what you could and what makes sense and what is scientifically proven to be a very effective tool in helping to curb this current pandemic. So I will leave it at that, other than to say, after nearly 3 months and over 9 million doses now given to kids in the United States and Canada aged 5 to 11, it's well established that the vaccine is safe. We've seen no significant safety signals come out of the United States after months now. It's highly unlikely that, if not impossible, for the actual vaccine components to now suddenly show up and cause some sort of a adverse reaction of some sort. As Kevin mentioned, the vaccine products themselves are completely degraded. The mRNA that's used is completely degraded. All you're left with is antibodies and an immune system that is aware of the virus. At some point, we will all meet coronavirus. You know, it's going to become endemic. We don't think we're going to wipe it out and eradicate it like we have done with very few other pathogens in our world. So it's going to be around. We're going to see some flare-ups, but much better to meet coronavirus with antibodies in your system than without. And the safest way to get those antibodies is through vaccination. That is, I'll stop sharing now as well. And that's all I had for my presentation. Thanks.
Thank you both so much. That was, you know, I've watched I think just about every presentation you guys have given, but I learned something new every single time. We do have one question. I think you addressed it already, but we'll just clarify. If we get a positive rapid test, do we still wait the 90 days post-infection for vaccine as when we are doing PCR tests?
So I'll jump in for adults. Rob can say if it's any different for children. For adults, so if you have a positive test, then you want to wait until your isolation period is over, and if you have symptoms, until your symptoms are resolved. If you've got like a minor post-viral cough that doesn't go away for weeks or months, something like that, it's okay. But you want to make sure that you don't have any sort of the symptoms from the acute illness left behind. That's for the safety of those that are giving the vaccinations, and also so we can monitor for side effects. But aside from that, then you can get the vaccine at any point, and you don't have to wait any specific period of time. And it's still recommended to get it even if you've had COVID before. It still helps to boost the immunity and just keep those antibody levels high for as long as possible.
Yeah, I agree with that. From of course, with kids, we're not giving boosters, but if you've had a rapid test and you're positive, in terms of like, do you start the vaccination, or do you you give your second dose? Again, like Kevin said, you want symptoms to be resolved, and personally, I would wait about 2 weeks or so after symptoms are resolved, just to be sure that you're not infectious anymore, and your body's able to mount a good immune response to the vaccine.
Great, thank you. I don't have any other questions at the moment. So obviously you have covered a lot of, and you did get a few questions in, and so you both covered those in your presentation. So thank you so much. I will agree with you, Dr. Meeder. I am just very grateful that all of my family are all boosted as well. And if we happen to come into contact with COVID, we have that peace of mind in our family as well. So you know, we were happy to get it, and my son was also eligible, so he was very happy to get it as well. So thank you so much to the both of you for sharing this today. We are recording it, so we will post those and the slides as well for you to share. They'll be in the bulletin tomorrow, and probably with a link in Safe and Well as well. So thank you so much. We really appreciate your knowledge and your time that you shared with us today. And thank you to all of our participants for joining us today. Have a warm and nice afternoon. Take care.
Recording.